Hello, this is Dr. Grande. Welcome to my video on the Integrated Developmental Model of Counseling Supervision. So before I get into the specifics of the model, I want to answer the question, what is supervision? Supervision is an intervention provided to an inexperienced member of the counseling field, for example, an intern, by an experienced member of the counseling field, for example, a licensed professional counselor. This professional supervisory relationship is evaluative and it has a gatekeeper component. So what this means is the supervisor is evaluating the performance and the skill development of the supervisee, and we hope in rare instances has to act as a gatekeeper, meaning has to prevent a supervisee who is not appropriate to enter the field from entering the field of counseling. Supervision serves to improve counseling skills, and it encourages professional development of the supervisee. It's also designed to monitor the quality of treatment that the supervisee delivers to the supervisee's clients. Supervision is not intended to be short-term. Typically lasts anywhere from 6 months to 2 years, but it can certainly be of a longer duration if necessary. It's also highly structured. There is an informed consent, an agreement that is signed that outlines the obligations and responsibilities of both the supervisor and the supervisee. So now let's take a look at the Integrated Developmental Model as proposed by Stoltenberg, McNeil, and Delworth. This model is considered a stage model, and it starts by looking at markers of professional growth that are assessed using 3 constructs or structures: awareness, motivation, and autonomy. So let's take a look at awareness, or what is referred to as self-other awareness. This is related to how the supervisee sees themselves in terms of self-preoccupation, awareness of their client's world, and their own enlightened self-awareness. Motivation deals with the supervisee's interest, investment, and the amount of effort they expend in their clinical training and practice. And autonomy reflects the degree of independence that the supervisee is demonstrating. So by assessing these 3 constructs or structures, a supervisor can place a supervisee into one of 4 categories: level 1, 2, 3, and level 3I. So let's take a look at these 4 levels, remembering that they are determined by the supervisor's assessment of motivation, autonomy, and awareness. So in level 1, the supervisee's motivation and anxiety are high, and the supervisee is focused on acquiring new counseling skills. They often want to know the best or correct approach to take with clients. As far as autonomy, the supervisee is dependent on the supervisor, and the supervisee, that is, needs structure, positive feedback, and sometimes a certain amount of direct confrontation. And in dealing with awareness, the supervisee has high self-focus but limited self-awareness and is apprehensive about being evaluated by the supervisor. So as you can see, supervisees that fall into level 1 typically have limited training and limited experience. So as they move to level 2, they're making the transition from being dependent on the supervisor, and having limited self-awareness, to becoming a little more independent and a little more self-aware. So in level 2, motivation fluctuates as a supervisee goes from being extremely confident to not being confident. In terms of autonomy, the supervisee begins to function more independently. However, there is still a conflict between autonomy and dependency. This conflict can appear to an experienced supervisor as resistance. So that's how a supervisor can pick up that the autonomy construct is operating within level 2. When they see that resistance in the supervisee along the lines of autonomy versus dependency. As far as awareness, the supervisee has a greater ability to focus on and empathize with clients, but balance is still a problem for the supervisee, and enmeshment with the client is a risk in the awareness construct in level 2. Level 2 in general is considered to be a turbulent stage, and supervisor skills need to be considerable, and one of those skills needs to involve flexibility. As supervisees move from level 2 to level 3, they start focusing more on a personalized approach to clinical practice and a better understanding of who they are as a counselor. Motivation is more consistent, although there still are some occasional doubts regarding effectiveness, but these doubts aren't so severe as to stop the supervisee from providing good client care. As far as the autonomy construct, a strong belief in the supervisee's professional judgment has developed, and the supervisee moves more into independent practice. The supervision relationship in general becomes more collegial as the differences between the skill levels of the supervisor and the supervisee decrease. And on the awareness construct, the supervisee is very self-aware and able to focus on the client. So this allows the supervisee to step back and take a look at their own personal reactions to the client, and then include these reactions in their decision-making process about how to treat the client. So as you can see, level 3 is a fairly high competency level as far as a supervisee, which is why there isn't a level 4. It moves to level 3I. And what level 3I really is where the supervisee develops their own personalized approach to professional practice, which they do by integrating multiple domains, including the use of counseling skills, appraisal skills, and case conceptualization. Level 3I, the supervisee has a strong awareness of both strengths and weaknesses. So you may be looking at these different levels and thinking that it's interesting that we can categorize supervisees in different levels, and the levels have meaning, and these are stages that we see in the supervision process. But what can we do with this information? So that takes us to Integrated Developmental Model interventions. There are 3 major types of interventions in the Integrated Developmental Model. The first is facilitative, the second authoritative, and the third conceptual. It's important to note here that the first 2 interventions, facilitative and authoritative, were proposed by a researcher named Huron, and the last intervention, the conceptual intervention, was proposed by Loganville and Stoltenberg. So let's take a look at the subcategories of the first intervention type. And we have three: cathartic, catalytic, and supportive. Cathartic interventions are those designed to elicit an affective reaction from a supervisee. Catalytic interventions involve the supervisor asking open-ended questions, and these are designed to promote self-exploration in the supervisee, as well as to improve problem solving. And the supportive intervention is designed to validate the supervisee. So the facilitative interventions are designed to allow the supervisee to retain some control in the relationship, which is different than the authoritative interventions, which give more relational control to the supervisor. And there are three authoritative interventions: prescriptive, informative, and confronting. Prescriptive involves giving direct advice to the supervisee and making suggestions about what the supervisee should do in session with the client. Informative is where the supervisor provides information to the supervisee. And confronting is where the supervisor points out discrepancies observed between or among supervisee feelings, attitudes, and/or behaviors. So then we move to the third broad classification of interventions. These are the conceptual interventions. And there's two interventions in this classification. The first is where the supervisor stays on the lookout for the supervisee's use of a particular strategy, then helps the supervisee to develop a conceptual frame for that strategy. The second is where the supervisor presents the strategy and then encourages a supervisee to use an intervention that is based on that strategy. The main objective of the conceptual interventions is to help the supervisee connect theory to practice. I want to thank you for watching my video on the Integrated Developmental Model. As always, if you have any questions, please feel free to contact me and I'll be happy to assist you.